Gotta get my mask on for the day. Oh, my keys. Yes, let's go, let's go, let's go. So my first day of residency, I actually got lost and I took the wrong exit and I was, I think, 10, 15 minutes late in a panic. Showed up with my Starbucks, so it looked like I was late because of the Starbucks. A typical day, we start at 7:45 with pre-clinic conference, and we usually are assigned a topic or a small module that we have to read, and then we meet with the team and the doctor to discuss it.
How are you?
Good. How are you?
Good.
And usually they're primary care oriented modules. So last week we did atopic dermatitis and asthma.
What would you suggest to the patient?
So I would say to have a topical steroid available. So if you are having flares that you have something, so.
Exactly, that's exactly right.
So what I do before I see a patient is I'll read up on, all of their medical history and what medications they're on. I usually like to know her last labs. My name is Sushmita Malik. So Dr. Malik. Yes? Yes, nice to meet you too. So Dr. Chang has told me all about you and sort of what brings you in today to clinic. You got lab work done recently. But before we start, tell me a little bit about yourself, since this is my first time meeting you. Hey, Dr. Branco. So, I just saw a patient.
Okay.
She says that when she's exercising, after 10, 15 minutes, she'll notice that her heart rate will go up. She feels a little bit more short of breath, and she'll just stop, rest, and then carry on. That's been going on for quite some time now.
What is your plan for that?
I do want to get an echo.
So echocardiogram, I think, is a good thought. What do you think about
Like an EKG?
Yeah, so we can get an EKG today, and I think we have a good plan going in. Why don't we go in and go from there?
Sounds good. Okay. The EKG.
So what do you see?
So I always start with rate, rhythm, and axis. Hi, I'm back. Hi. So your EKG looked normal, and we compared it to the prior one. So it looked stable. So that's good. So what we're gonna do, I wrote everything down for you.
Thank you very much.
Yes, of course. It was nice meeting you.
Hands, but
Yeah, it was very nice meeting you. Okay.
thank you.
She was a super, super sweet, nice patient. This is, typical day. I mean, it's good that I get to start everything from start to finish.
So tell me about the patient.
So he is a 44-year-old male presented with a 3-day history of nausea, vomiting, and lower quadrant abdominal pain. We got a CT abdomen, which was just done, and it showed
Thank you for doing that. That's perfect.
It showed appendicitis. Hi.
Hi.
How are you feeling?
I'm not feeling good.
Okay. Yeah.
Nausea.
Yeah. The CT is actually showing appendicitis. What we're gonna do is we're gonna contact surgery because this is something that needs to be taken out.
Yeah. Good news is it's curable.
Thank goodness.
Yeah. and you'll need several days to recover from the surgery, maybe a week off from work, but this is fixable.
Okay.
Pain as well.
Thank you so much. Thank both of you.
Yeah.
Thank you.
Oh, you're
Of course.
Thank
All right.
Okay.
Take care.
Take care.
you. Thank you.
So Academic Half Day is really unique to our program. It's essentially where there's protected didactic time weekly every Wednesday where we just essentially have specialists come and talk to us. Like today we have Dr. Huang from oncology that's going to talk to us about colorectal cancer and other things like that.
Okay, and unless you remember this, you're gonna miss it. You're just gonna assume they need a colonoscopy at 50. Okay, so then you could miss somebody's colon cancer.
I love learning from the specialists at Kaiser. They're really, really knowledgeable and they take the time to explain things in depth. We do all things from oncology to cardiology to neuroradiology, so it's very broad. What's fun is what they like to do is half didactics and half Jeopardy to make it sort of more interactive, and so it becomes like a competition.
Colonoscopy.
So unfortunately today the boys won, but last week the girls won.
And we're singing happy birthday to Rachel and Crystal. 1, 2, 3. Happy birthday to you.
How are you guys? We like getting together every week. It's good to catch up and sort of debrief about everyone's week, see what everyone's up to.
Wow. Thank you so much. It's huge. Thank you.
So I'm really happy that we get to do this every Wednesday and spend time with each other.
Cheers! Happy birthday!
Happy birthday, guys!
Oh, yeah. Maybe we